So, good morning, everyone, and welcome to this mini lecture on the concept of autonomy in healthcare delivery. This video presentation is not a standalone lecture, it is designed to complement the existing PowerPoint presentation that has already been uploaded onto my learning. So, I would encourage you to use the two of them in conjunction with each other in order to gain a more complete picture of the concept of autonomy. So, let's get started without further ado. So, what is autonomy exactly? And in the first edition of the very famous medical ethics textbook, the medical ethicists Beauchamp and Childress wrote that a person's autonomy is his or her independence, self reliance, and self contained ability to decide. So, before a patient exercises his or her autonomy, there must be one or two essential conditions that must exist prior to that exertion. So the first condition must be that the patient must have what we call agency. And agency is defined as the capacity for intentional action or the ability to make free choices. So obviously, if a patient is unconscious, then they can't exercise. They can't exercise that agency. They don't have agency. So in that instance, medical professionals are allowed to make decisions for the patient. We'll see that later on in the lecture. Additionally, the other condition is that patients must be provided with all the information that they, in order to make a decision. So, as medical professionals, we are obliged to give patients as much information as they need or as they want in order for them to properly have agency and to exercise and to have that ability to make free choices. Another definition is that patient autonomy in medicine, and we're talking about a specific definition of autonomy in medicine now, and it is the right of patients to make decisions about their medical care without the doctor trying to influence their decision. So, autonomy allows the doctor to educate the patient, but does not allow the doctor to make decisions for the patient. And when doctors do make decisions for the patient, this is known as medical paternalism. So, this is what attended in previous years, maybe the 40s, 50s, 60s. Uh, Doctors made decisions for the patient. So if the patient needed a medical procedure, doctors would say, you need this. If they needed a surgical procedure, doctors would say they needed this. And the patients would have no input into the decision. They may have wanted to have input based on their religious, cultural, socioeconomic backgrounds. But in those days, they weren't allowed to make to have any kind of input into decision making. Doctors made all decisions. The situation in modern times is we have dispensed with that medical paternalism, and now the patient is more in a partnership with the clinician, and the patient, after the physician discusses the condition with the patient, then and gives the patient all the information that is required, then the patient makes that decision, and whatever decision the patient makes is the one that holds. The doctor is not allowed to bully or browbeat the patient into making the decision that he or she thinks the patient should come to. So, how is patient autonomy expressed? I discussed that just now. So, it is the right of competent adults to make informed decisions about their own medical care. And just to emphasize that word informed. So, remember, you must give the patient as much information as they want in order to come to a decision. And so, therefore, we as doctors, we seek the informed consent or agreement of the patient before any investigation or treatment begins. And just as an aside, informed consent is not valid if, as medical professionals, we don't give the patient all the information that they need or want. So, the law in the UK says an adult patient who suffers from no mental incapacity has an absolute right to choose whether to consent to medical treatment. And this right of choice is not limited to decisions which others might regard as sensible. So, as medical professionals, sometimes patients are human. Occasionally, patients will make decisions that go against the grain of what we have been taught as medical professionals, what we see in our expert opinion as being in the patient's best interest. The patient may refuse, and as long as the patient has what we call full mental capacity or sound mind, um, we as medical professionals, it's part of being a professional. We are obliged, we may not like it, but we are obliged to go along with what the patient decides because the patient is exercising his full autonomy. And this is a comment from one of the judges in a case that challenged the patient autonomy. And it exists notwithstanding, part of the comment was that it exists notwithstanding that the reasons for making the choice are rational, irrational, unknown, or even non existent. So, in actuality, the patient, it may seem completely irrational to a medical professional like you and me, um, but that is not the point. The point is that the patient is of sound mind, and it can be completely irrational. The patient doesn't even have to rationalize his or her decision, or the means by which they came to that decision. Um, Even if it's irrational, they could have no reasons at all. They could just be pulling it out of a hat. Um, their decisions stand. As medical professionals, we must respect the patient's autonomy. So autonomy goes along, it's just one of the four pillars of medical ethics. So autonomy is the first one. The second is beneficence. Beneficence, bene, Latin means to do good. So we must, as medical professionals, we must do good for the patient. The third pillar is non-maleficence. Mal, in Latin, bad. So we're trying not to do no harm to the patient. And the fourth and final pillar is that of justice. And justice means that as medical professionals, we try to deliver healthcare equitably, regardless of patients' socioeconomic status, their gender, their sexuality, etc., their religion, so forth, right? So we move on now to what factors can compromise or influence a patient's autonomy. So in general, things that compromise their decision-making skills. We had a little discussion about agency in a previous slide. And I had mentioned that if the patient is unconscious, then they can't exert that agency. Other things, so unconsciousness is there. So if the patient is unconscious, they can't make an autonomous decision. If there's any confusion, by confusion I mean medical reasons for confusion. So the patient may uh, be suffering from dementia. Um, they may they may have a be suffering from a drug overdose, cocaine, ecstasy, zessa, whatnot. Um, Alcohol is another frequent cause of mental confusion. So these medical reasons for confusion. Intoxication, I spoke about alcohol. So the intoxicated patient, their autonomy is compromised. And of course, poorly controlled psychiatric illness. I put poorly controlled specifically because there are some psychiatric patients who have been quite stable for many years on their medication, and when they come into hospital, they tend to get labeled as being psychiatric case and therefore having no patient autonomy, and that's simply not the case. Um, Stable psychiatric patients are capable of making fully autonomous decisions and exerting that autonomy. So that's why I put poorly controlled psychiatric illness there. So just to review, patients who are confused for any reason, patients who are unconscious, patients who are suffering from drug overdose, patients who are intoxicated, and patients who have a poorly controlled psychiatric illness, these things compromise a patient's autonomy. Some conditions for autonomous decision making. The individual has the capacity to make the decision. So in the previous slide, we saw those conditions that could impair a patient's ability to make that decision. The patient has sufficient information to make the decision. So again, as medical professionals, we are obliged to give them all the information they want. And the patient does so voluntarily. And so that again goes back to medical paternalism. There is not so much coercion, but the patient must make that decision voluntarily after having received all the medical information that they need from or want from the medical practitioner. So some just to tailing off towards the end of the presentation now, we want to discuss briefly some practical applications for respect for autonomy. So Jehovah's Witnesses and blood transfusions. Um, Jehovah's Witnesses believe very strongly, as part of their religion, that they should not receive blood or blood products externally. This is part of their religion. It may be irrational to us who are not Jehovah's Witnesses and are practically medical physicians, especially when the Jehovah's Witness patient comes in with bleeding. It goes against the grain of everything that we've been taught in terms of resuscitation and blood loss and oxygen delivery to the cells. However, again, this is a Jehovah's Witness patient because of their religious beliefs. It is important to them, and as long as their decision-making capacity is not compromised by any of those conditions we previously discussed, then their decision to refuse blood and or blood products must be respected. Some patients may refuse treatment, again, after having had a long discussion with the patient, and the disease may be quite a serious one. After all giving them all that information, they may still decide not to accept his or your advice. And as medical professionals, we could be completely flabbergasted by the decision. It may seem completely irrational, as Lord Donaldson said. However, we have to respect the patient's decision. Okay. And finally, a classic example: we're in the midst of a global pandemic. Um, Again, one of the exercise, and we're seeing the exercise of patient autonomy in those patients who are refusing to get vaccinated against COVID vaccine. It may seem irrational to the rest of us, the vast majority of the population, who can appreciate the science behind vaccination and herd immunity and whatnot. However, these patients have full mental capacity. They're not compromised in any way. It may be rational to us as medical professionals and public health specialists, especially with our low vaccination rates. However, this is another practical example of patients exercising their autonomy. Okay, so this is the end of my short video presentation on autonomy in healthcare. I hope you enjoyed it, and just a reminder to use it with the existing PowerPoint presentation on my evening. Thanks very much for your time, and have a good day.